Hi everyone. In this video, I'll show you how to test blood sugar or blood glucose using a glucometer. Before we begin, let's take a quick look at the items you'll need. Glucometer, glucose test strip, alcohol swab, safety lancet, gloves, and cotton or dry swab. Using a safety lancet is safer and reduces the risk of accidental injury. Let's quickly look at the parts of the glucometer. This is the display screen where the test result and related information appear. This is the power button. And this is the test strip port where you insert the test strip. On the back, you have the strip ejector. Now let's look at the test strip. One side of the test strip has markings while the other side is plain. The side with the markings faces up when the strip is inserted into the glucometer like this. This is the connector end or electrode end where you can see these metallic contact points. This end is inserted into the test strip port of the glucometer facing upwards in the direction of these arrows. The other end has this narrow banded region known as the sample window or the sample tip, and this is the place where blood is applied. On inserting the test strip, the glucometer turns on after a beep. Symbol with a test strip and a flashing blood drop appears on the display. Now the glucometer is ready to use. Now let's get started with the demonstration. Before starting the procedure, perform hand hygiene by soap and water or alcohol-based hand rub. After that, wear gloves. Clean the fingertip with an alcohol swab. You have to choose either the middle finger or the ring finger. Allow the finger to air dry completely before pricking. Take out a strip from the strip vial. Close the lid of the vial properly to avoid moisture. Insert the connector end of the strip into the strip port of the glucometer as explained earlier. The device will turn on automatically. Now take a safety lancet, place it firmly on the side of the fingertip and push the lancet's trigger. Remember to insert the test strip into the glucometer before pricking the finger. Allow a drop of blood to form. Now touch the sample tip of the test strip to the blood drop. Blood gets drawn in by capillary action. On a countdown of a few seconds, the glucometer analyzes the blood sample and the result appears on the screen. Now eject the strip by sliding the strip ejector. It's important to discard all the wastes including the strip and the lancet according to biomedical waste management guidelines. Here are the normal ranges of blood sugar. Fasting blood sugar is measured after at least 8 hours of fasting. Postprandial is tested 2 hours after a meal, and random blood sugar can be checked at any time. Got any questions? Drop them in the comments. Don't forget to like, subscribe, and stay tuned for more informative videos. Thanks for watching.